My history with Envy is kind of interesting because the platform that it's built on is the Envista platform, and I happen to be very lucky to be the first person in the world to put an Envista lens in. And that was pretty exciting. In my practice, because I'm a boutique practice and they talk to a surgical counselor, I am really educating them about the Envy toric lens and Envy multifocal without toricity. I really try to educate my patients, and I put it on my website so that they know how important that is. And I've really gotten away with mostly just using Envy over the last, like 8-9 months. Having Envy in my own eyes, I have no problem offering it to my patients. For many, many years, I never wore glasses for anything I did. I was 20/10 far away, and I was about 45 before I started to wear reading glasses. And then as time went on, I needed plus lenses to see far away, and I needed, more power to see up close, and I had a pair on my head, always for, distance or whatever, or for reading, and it was ridiculous. So it was really annoying. And I thought the technology had gotten pretty good, and maybe I would just go forward and see what it would be like. One very special doctor that's up in Largo, Clearwater area, and he liked how he treats patients, and he did a great job with my mom. So you know what, I called him and I said, hey, I'm thinking about I'm late in hyperope, and I'm thinking about having my cataracts, what cataract I have, but having my lens extraction. He said, absolutely, when can you come? When I decided about the surgery, I thought, I'm gonna really take care of my dry eyes. I chose to use MyBo and really liked it. So I went on MyBo 4 times a day. I did scrubs and hot compresses, and I did an oral vitamin, and I really was diligent about it. And I felt like if I could follow that, and then maybe when I went in, maybe I could be, have a presbyopia correcting lens. When Neil, his office, his techs did my pre-op testing, he looked at it, he said, Dee, your cornea looks so much better than it did. You are certainly a candidate for having the Envy presbyopia correcting lens. And I said, really? And I said, would you do it? And he said, well, yeah, let's do it in one eye. Let's do it in your non-dominant eye. Let's see how we do. I had my first eye done, and I was blown away how weird it was to be able to see all these distances. Now, it wasn't perfect the first morning, but it was darn near perfect. And I did surgery the following Tuesday with only having one eye done, and it did not bother me. I had my second eye done the following week, and I have not looked back. It has been such a wonderful experience. Given that Bausch & Lomb's like a 172-year-old company, and they're still standing, and given the fact that I worked with them and their technology for about 32 years, I think I have a pretty good judgment of the quality of their products. I never thought that I would be able to see as well as I do, and the quality of my vision is fabulous at every distance, intermediate, near, and distance. I think that all patients that want presbyopia correcting IOLs have an awfully good chance of being very, very satisfied with their vision if they choose Envy.